Coming up, we know there's an obesity problem in this country, and it's affecting our kids, our teens, worse than ever. But here's what we're finding out. Is it the best way to go for a teenager to undergo some sort of stomach procedure, bariatric procedure, lap bands, gastric bypass surgery? Have we come to that point, or is it too soon for a teenager to have to undergo that procedure? Call in with your thoughts. The number 1-877-TEL-HLN. All right, I know our kids aren't as active as they used to be, and for some that could mean some dangerous health concerns. But are we really at the point where our kids need stomach surgery procedures? Well, there's a new bariatric program for teens at Rose Medical Center in Denver. First of its kind in Colorado that we know about. There's other places, different parts of the country. Now, what we're talking about here, most of these kids get a lap band inserted. It's gradually tightened to cut down the size of their stomach so they can't eat as much. Your question, probably mine as well. Isn't it a little soon, unless we're talking about a life or death situation? We'll take your calls, your comments. 1-877-TEL-HLN. Joining me now to talk about this, Dr. Mark Wolcott, pediatric surgeon, Emory University School of Medicine and Children's Health Care of Atlanta. Also with us, Dr. Wendy Scinta, bariatric physician and founder and director of Medical Weight Loss of New York. Dr. Mark Wolcott, you perform the procedure, the lap bands.
Yes, I do.
Oh, yeah. Why do you believe in some cases this is the way to go for someone who's just a teenager?
Well, the reality is that most kids that get to the point that we consider surgery, that is those kids with BMIs over 40 or over 35 with comorbidities, and what that means is BMI is a relationship between your height and your weight. And these are kids that are usually at least 100 pounds overweight. When you get to that point, you just can't get all the weight off. Only about 5% of kids are successful.
Okay, I think a lot of folks at home want to know this as well. It's my second question, is what's the procedure? I'm sure they don't come in and it's like, hey, sign me up. There's got to be a process here to make sure diet, exercise, and all that has already been exhausted.
Sure. The kids in our program go through at least typically 6 months of testing, of evaluation. They go on to a strict diet that's supervised by pediatric doctors that are specialized in pediatric weight loss. Then once they complete that program, if they're overweight and they qualify, then and only then do they go for surgery.
Okay, let's bring in Dr. Wendy Scinta. Wendy, what are your concerns with this?
Well, I have several. I think initially you really have to focus on lifestyle changes, in particular with children, family changes, because the eating patterns of the family so affect that child, and I don't see how you can, I really see it as the cart before the horse. You really need to focus on those issues first before you start to inject surgery.
Dr. Wolcott, do you do that? I mean, is there an extensive background on what the family's lifestyle?
Yeah, I agree. This really is it's a family process. It's not just the kid. One of the questions that we ask the children when they come is, why are you here, and do you want to do this? And you ask the parents, do they want to do this? The whole family needs to be on board. And as part of our evaluation, we have psychologists that talk to the parents and the kids. We have nutritionists that work with the moms and the dads and the children. It really is, it's a family disease, and everybody has to be on board.
Wendy, any other concerns?
Well, I think when you're dealing with children, it really is children are a different breed. Any of us who have children know that. And especially when you're dealing with kids who are in that prepubescent or have gone through puberty, they're not developmentally at a place where they can see the big picture yet. Medically, there are vitamin deficiencies that are going to last a lifetime. I have a 12-year-old, and I know you have children, Mike,
yeah.
And I can't get my kid to take a multivitamin in the morning, much less have them take a lifetime of iron, vitamin D, B12, and calcium, which is what you're going to need if you undergo gastric bypass surgery.
Dr. Wolcott, does it concern you that we don't know the long-term effects of this?
Yeah, it does concern me, and that's why I think this should be done in a way that's studied, that's done very carefully. We have our center that's based at a university where we study our children. There are many other centers like this around the country, and we don't know all the answers, but we do know that these kids that are 100 pounds overweight or more really have no other options. We're already seeing diabetes. We're already seeing high blood pressure in these children, and we know that the operation can reverse that. Not only that, from a psychological standpoint, you know, you're right, these are very vulnerable kids. If you look at their psychological makeup,
Right.
they're about as happy as kids that are getting chemotherapy. It's been studied. These are just, they're not happy, they're sad, and they want to just be able to do the things that other kids can do. And we can help them with that.
Okay.
When you get them to lose weight, they're very, you know, they are very grateful, and it works.
Okay, guys, we're going to take a quick break. We've heard the concerns. We've heard Dr. Wilcon explain why, the procedures. We got some calls lined up. Call in. Your thoughts on this. Is it too soon for a teen to undergo this, or is this the way to go after careful consideration? You know the number, 1-877-TEL-HLN. Welcome back to Prime News on HLN. Continuing our conversation, teens getting gastric bypass, lap bands, stomach procedures because they're really morbidly obese. That's what we're talking about here. The first concern for many of you, I'm sure, isn't that a little early for a teenager? We have doctors lined up on both sides, taking your calls, your comments. Read a couple of Facebook comments. Nurse Z writes, we live in a quick fix society and need to draw the line beginning with children. How about this one from Tanya? If the parents support it and the teen has failed, the option should be available. One more Facebook log coming in. A teen's body hasn't even reached maturity. This type of surgery will stunt growth. Let's bring in Dr. Mark Wilcon, performs a procedure, Emory University here in Atlanta. What about that? Is that a valid concern?
Well, we don't do the procedure on kids until they've completed at least 90% of their growth. What a lot of people don't know is that overweight kids actually mature early. And many of these kids, by the time they're 12, 13, 14, have achieved their full height.
Mark, what's the youngest teenager you performed the procedure on?
13.
13.
13.
Okay.
And she's one of my best patients.
One of the best patients. Success story.
Yeah.
Okay. Let's get a couple of calls in. Matt's with us in Maryland. Matt, your thoughts?
Hello there. Yes, I believe I agree with Dr. Mark there. The lack of self-confidence, the diseases that it causes throughout your life is unbelievable. I'm 53. I recently lost 160 pounds, and now I have to put up with all this loose skin. But the problems that the overweight caused as growing up with the embarrassment, the diseases that it's caused, I would have been glad to have had that surgery if it was available to me at that younger age.
Mark, congratulations first off. We wish you continued success. Matt, excuse me.
Can I respond to this?
Yeah, one quick question. Matt, was diet and exercise, did you exhaust all that when you were a child, when you were young?
No, I just recently lost it in the last 3 to 5 years.
Okay, so diet and exercise didn't work for you?
Tell you, it is hard to get someone of that age to get on a regimen that they can comprehend. They do
Gotcha.
not understand the consequences of being overweight when you are that young.
Okay, gotcha.
All you know, all you remember is being the embarrassment, being left out, being picked on, being bullied. If it was available to me at that age, I would have gladly have done it because my family had the means to
Gotcha.
help me at that time.
Okay, Matt, thanks for the call. Let's bring back Dr. Wendy Scinta. Wendy has concerns about this for teenagers. Wendy, go ahead.
I just wanted to make sure that people understand that there are steps available that I'm not sure people are exhausting prior to surgery. And one huge step is getting in touch with a bariatrician in their area. I am a bariatrician. I'm board certified. I am on the board for the American Society of Bariatric Physicians, ASBP.org. There's a Locate a Physician website if you're concerned. Bariatricians do the same process, but they do it medically using nutrition, behavior, exercise, metabolic issues. I have reversed diabetes in patients. I have reversed cholesterol and hypertension. And with children, it really needs to be a very important step ahead of time. I, too, have had children lose in excess of 100 pounds. And I find, by the way, as far as the growth issue goes, that they actually start to grow again, which is very interesting to me. I haven't done studies on this to quite understand why, but these kids who are 14, 15, and 16 who previously weren't growing keep growing.
Wendy, thank you. Mark, you as well. You've heard both sides. We'll have more news coming up. Keep it right here.